Hi Mata, how are you?
Good, how are you?
I'm very good. Welcome back to the clinic. I see your hair looks a little bit lighter. It looks really, really cute. So you're here for a head-to-toe exam, right? And I've seen you before, but I just want to ask if there's anything new today that's been bugging you or any new health concerns.
Yeah, I think I've been experiencing back pain.
Okay.
Kind of like feels uncomfortable when I lay down.
Okay.
Also when I do activities, even walking or light lifting, I think really causes my back to have that pain. It's very on and off, but I feel like it's been concerning.
Is this upper back, lower back, or is it difficult to tell?
It's mostly upper back.
Okay.
But I have experienced some pain in the lower area as well.
Okay. When did this begin?
It's a little over 2 weeks.
Okay. Sorry to hear that. Has it been getting progressively worse?
Yes.
Okay. And what have you been doing to address the pain so far?
So far just like warm compress or I've been taking ibuprofen.
Okay.
Like 2 to 3 times a day sometimes.
Oh, wow. Okay. Definitely want to start to take steps away from that and really get to the root of the problem. Do you remember anything that you did that might have spurred this? Any activity, physical exertion?
So I rollerblade. I kind of had a fall. At first it didn't really hurt much, but then after about like 2 days, 3 days, that's when I started having the pain.
Very classic. Okay.
But that was pretty much it.
Did you fall backwards or?
I did. Yeah.
Oh my goodness!
Yeah.
I'm so sorry to hear. Okay. Well, definitely look at the area, assess any visible or palpable issues, and we'll try to do some treatment today. Okay. And you said numbness and tingling, or?
Numbness was mostly in the beginning.
Okay.
Now it's just kind of like sharp pain.
Oh, I'm so sorry. Okay. So when you have a sharp pain, is it on a particular side?
It's mostly in the middle.
In the middle, okay.
Yeah.
Okay. Any lifestyle or diet changes since I last saw you?
No, not really.
Okay, good. Okay, well if that's, if you have no other questions, we'll go ahead and begin the exam. We'll do vitals and we'll get you on the bed and finally take a look at your back, okay?
Thank you.
I'm gonna start just by sanitizing my hands. Okay. Is there a particular time of day that the back pain is at its worst?
In the morning and also at night. So in the middle of the day, because of the painkillers, a little better.
Yeah, is it hard to sleep?
Yes.
Okay. Okay, I'm gonna go ahead and listen to your heart and your lungs, okay? Just getting a sense of your whole chest. Okay. Heartbeat sounds normal and healthy. So that's good. I'm just going to listen on the bell side just to make sure we don't have any murmurs. Okay, great. No murmurs present. I'm going to go ahead and listen to your lungs. So, excuse me. Just take a nice deep breath in for me and relax. Good. And one more. And out. Excellent. Okay, I'm just going to listen here on the other side. Deep breath in, 2, 3, and out. All right. Great. Stay right where you are. I'm just going to listen to your back. Okay. Go ahead. Thank you very much. Okay. Sounds very normal. So everything sounds good from a respiratory perspective. Let's go ahead and get your blood pressure. Yes, your legs are uncrossed. Okay, 108/70. That's really, really good. I'll just slide this off. Perfect. Okay. And next we'll do your oxygenation. If I can get your index finger. It's very pretty nail polish. I like the sparkle right there. Okay. Okay. Heart rate. Let's let that settle. It's 88. Okay, oxygenation is 95% room air. Okay, great. Just go ahead and take that from you. And all right, and lastly, I'm going to take your temperature. So just hold still. Okay. 96.8. So perfect. Any cold or flu-like symptoms in the last couple months?
Just like headaches here and there.
Okay. I know there's a lot of congestion and respiratory infections going on right now, so it's good to hear you don't have that. All right. All right, I'm going to go ahead and take a look at the skin, okay? Just going to tuck your hair behind your ears very gently, okay? Just making sure that I'm not seeing any discoloration. Any numbness in the face? No. Okay, good. Okay. I'm gonna go ahead and palpate your head, okay? So just relax. My fingers are a little bit cold. Okay. Just feeling your lymph nodes. Making sure they're not palpable. Feeling right in front of the preauricular, behind at the same time. Okay. Okay, I'm just gonna feel right under your sinus cavities here. Any pain or tenderness? Okay. Feels normal to me. I'm gonna feel the back of your head too, just to feel. I know you had that fall. I just want to make sure there's no signs of a concussion. Any head pain? Well, you did mention headaches.
Yeah.
Yeah? Okay. Okay. going to do, I'm sorry, get your hair in the way. Okay, we're going to do some facial myotones now. So you're going to go ahead and turn your head to your left against my push, okay? So 3, 2, 1, go ahead and turn. Very good, very strong. Let's do the other side. Okay, let's do the same thing, only I'm putting my hand gently on the side of your face. Push against me. Good, push against me. Okay, great. Now I'm going to put my thumbs right here. Try to lift your eyebrows. Go harder, lift it. Really try. Okay. Good. Now lift them all the way. Like that. Yes, and then lower. Very, very good. Okay. Was that difficult for you at all?
Maybe just a second when I had to raise them back.
When I was bothering you about it. All right. Pretty good. I didn't notice anything too glaring. Okay. And go ahead and try to look up at the ceiling for me. I'm just going to judge the movement of your cervical spine mobility. Chin to your chest. Perfect. Okay. So next we're going to do a sensory test. Okay. You're going to close your eyes for me and you're going to feel 1 or 2 brushes brushing your face at the same time. Let me know if you feel 1 or 2. Just say 1 or 2. Okay. So I'm going to tuck this back here. Okay.
1, 2,
Good.
2, 1,
Good.
1,
Yes.
1, 2,
Good.
1, 1,
Good.
2,
Good.
2, 1, 1, 2,
Okay.
1, 1, 2, 1, 2.
Okay. Now just with 1 brush, go ahead and keep your eyes closed. Do you feel it on your right or left side?
Left,
Okay.
right,
Okay. Now I'm going to be drawing the brush from the top of your head down to the chin. Let me know when it starts and let me know when it stops, okay?
Okay. Start. Stops.
Good.
Starts. Stops. Starts. Stops.
Good.
Starts. Stop. Start. Stop. Start. Stop.
Good. Okay. Okay. All right, so next we're going to do kind of the same thing, only with cold gloves. So let me know if you feel 1 or 2 at the same time. Close your eyes.
2,
Good.
1, 1, 2, 1, 1,
Good.
2, 1, 2, 1, 2.
Okay.
1.
Good.
1. 2.
Great. Okay. Just gonna do some percussions on the face. Close your eyes. Any pain, tenderness?
Maybe just the right side.
On that side, okay. Do you think it's coming from the ear?
Yeah, like here down.
Okay.
Oh, sorry.
No, it's okay. Just gonna blow it. Okay. That's good. Just go a little more gentle. Okay. And we're going to be doing some more vision tests when you're laying down, but I'm just going to look inside your eyes just because it's easier from this standpoint. Okay, go ahead and look straight ahead, pick a point on the wall. Perfect. Okay, pupils look round, constricting normally to light. Look up for me, look down. To your left, to your right. Good. All right, go ahead and look straight ahead. Okay, look up for me. Down, to your left, to your right. Okay, good. I don't see any signs of jaundice. Oh, you're looking right at me. I don't see any signs of infection or redness. Nothing to be concerned with. Do you have any issues with your eyes, like dryness, difficulty seeing?
Dryness, but not that often.
Okay.
Yeah.
Okay. I have some eye drops I could recommend for you that are sulfate-free, which is really good. All right. Well, if you have no other issues there, we're going to have you lay down and run some more tests, okay? But so far, so good. All right. So, just since you mentioned the numbness, I'm going to go ahead and put this blindfold on you. I'm going to be giving some objects for you to feel in your hands, and I want you to just describe them for me the best that you can. You don't have to get them all right, but I just am interested in texture, temperature, and shape. Okay, so yes, perfect. All right. And first object is right here. Go ahead and feel that with both hands for a moment. Describe it for me as best you can.
Like flowers, but plastic flowers.
Okay. No, yeah. Would you say it's a hard texture or soft?
Soft.
Okay. What's the temperature of it, would you say?
What's the
Temperature? Is it hot, cold, normal, neutral? Okay.
Neutral, yeah.
All right, great. And is it uniform throughout, or is there any varying texture in the center or sides?
It's kind of varying texture, especially in the center.
Yeah.
More dense.
Perfect. Okay, very good. Go ahead and take that from you. Okay. Okay. Here's your next item. Go ahead and feel it.
It's kind of like, it's like a circular option or item for sure.
Circular?
Yeah.
Is it flat like a quarter in a circle, or does it have
No, it's kind of like a curve to it.
Okay.
You can feel like kind of like lines on it.
Okay. So would you say that there's ridges?
Yeah.
Ridges on both sides or just on one side?
Just on this side.
Okay.
Yeah.
Okay. And what's the temperature of it? What'd you say?
It's a little cool.
Cool. Okay. Is it hard, soft?
Hard.
Hard. Okay. Perfect. Okay, I'm going to take that from you. Okay. So, I'm going to give you this next one right here. What does that feel like to you?
It's kind of like a pin.
It's like, okay.
Yeah, but
What would you call it? A clothespin, a safety pin?
Kind of like a safety pin.
Mm-hmm.
I do feel kind of like a texture on it.
Would you say that it also has ridges?
It does, kind of like, I would say like an earring style.
Earring. Okay. Is it hard or soft?
Kind of hard.
Okay. Would you call it metallic, or is there a fabric quality to it?
Feels more like metallic.
Metallic. Okay. And what would you say is the size of it? Is it larger or smaller than your thumb?
Smaller.
Okay, good. Okay, we'll take that. I'm just gonna do a couple more here. Okay. Go ahead and hold this. Okay. What would you say that is?
It could be like it feels like a facial roller.
Well, instead of trying to identify the object, what you did correctly, just tell me how it feels. Is it cold?
It is definitely cold.
It's cold? Is it hard in texture?
It is not. It is hard, but not textured. Maybe just this part.
Okay. So would you say there's more than one texture that you're feeling when you place it? Point to the softest part of it.
This is the softest.
That's the softest? Okay. And how large is it, would you say?
Kind of like my hand size.
Perfect. Okay. Wonderful. All right. Now that we have you in the blindfold, we're going to go ahead and do the smell test.
Okay.
Okay? Just to get that out of the way. Oh, I have one more thing. Actually, a few more things. Okay. Let me go ahead and let me see your hands. Yep. What's that? How does that feel?
Kind of feels, it's definitely textured, like little circles. It's definitely more than one or two. I can feel multiple ones.
Multiple objects?
Kind of feels like beads.
Beads. Good. So small circles.
Yeah.
Are they soft or hard?
They're hard and they're kind of cool to the touch.
Cool to the touch. Good. Okay. How many of them do you think there are?
I believe 4.
How big are the little beads individually?
They're very small.
Okay.
Maybe like the size of my nail, like, maybe even smaller.
Okay.
But very small.
And as a whole, and you hold them all in your hands, how large is it?
Like my palm, like the palm of my hand.
Okay. Okay, I'll go ahead and take those. Let's just do one more. Here, good luck with this one.
It's definitely hard in some areas, soft on the sides.
Would you say that it's smooth or pointy?
Pointy on the sides, but smooth in the middle.
Smooth in other areas?
Yeah.
Okay, how big is it?
Maybe a little, it's kind of like the size of my hand. Yeah.
Perfect.
So big-ish.
Would you say that it's long or short?
Kind of long.
Long in shape.
Yeah.
Okay. Cool to the touch or neutral?
Neutral. Neutral.
Neutral. Okay. Go ahead and take that from you. And now we will begin the smell test. So continue to relax. Okay. Go ahead and inhale. What does that smell like to you?
Kind of like lavender, but mint also.
Okay.
Can mix.
Chamomile. Close enough. Okay, next. Okay, go ahead and inhale on this one.
I smell vanilla actually.
Yes, that's perfect. Would you say that you have a strong sense of smell?
It depends.
Okay.
Maybe more for food.
Okay. Go ahead and smell this one.
It's kind of like almond flavor.
Okay.
Yeah.
It's interesting. There was a cinnamon, but you did get more of the savory kind of element to it. Just gonna write that down. Okay. Here's your next one. Go ahead and inhale.
Rose?
Yes, I love it.
Me
You
too.
got it right. Okay. Okay. Next, go ahead and inhale.
Mint?
Perfect. Step 2 more. Okay. Here's kind of a funky one. Go ahead and inhale.
I smell like kind of like jasmine.
It's tea tree.
Oh, tea tree.
I would say that's close enough as well. Okay. Okay.
Citrus, oranges maybe.
Perfect. That's lemongrass. So your sense of smell is very much intact. Going to just test your taste. I have a few testing strips. Go ahead and open your mouth, close, open. What does it taste like to you?
It's kind of like limey.
Yeah, that was citrus. Okay. Go ahead, open, close, open. What does it taste like to you?
This one's more sour, but
Okay, yeah,
kind of like sour, citrusy still to me.
That was bitter, so I think that was pretty good. All right, I'm gonna go ahead and take this off. Perfect. Now I know that there's a green light in the background, so it's not gonna be perfect, but go ahead and identify these colors, okay?
Close eyes or open eyes? Oh,
Open eyes.
yellow.
Okay, good. And now this color.
Green.
Okay, is it moving up or down?
Up.
Okay, good. And now this color.
Red.
Is it moving towards you or away from you?
Towards me.
Okay. And about this color?
Pink.
Good. Is it moving to your left or to your right?
Right.
Good. And we'll do one more. Okay.
Black.
Good. Is it moving towards your head or towards your torso?
My torso.
Very good. So, color recognition seems to be intact. Just going to give you a Snellen chart to hold. I'm going to hold this in front. Okay. Go ahead and read this row for me.
F, P, H.
Good. What about the one beneath it?
O, L, C, F.
And skip the one below that and read the one beginning with the E.
E, P, T, Z, O.
Good. Can you read the last row?
Yeah. L, T, F, P, H.
Perfect. And there's a row of objects down here. What would you describe those shapes to be?
Circle.
Circles. Good. Are they dark or light?
Dark.
Perfect. Okay. I'm going to give you a few words. Okay. Cat, candle, crevice. Go ahead, repeat those words.
Cat, candle, crevice.
Okay. Now forget about them. I'll ask you about them later. But just keep them in the back of your mind if you can. Okay. Go ahead and look inside your mouth. So go ahead, open. Okay, very healthy. Seeing very healthy tonsils. Nice gum color, good moisture. Any mouth sores or problems with the mouth? Canker sores?
Barely, maybe here and there.
Every once in a
my
while.
gums are kind of sensitive, but canker's so barely.
Okay. Are they sensitive to temperature?
Yeah, actually, during the winter month, it gets a little more sensitive.
Okay.
Yeah.
Do they get painful, itchy, or just sensitive to
just
any-
redness and
Okay. When was the last time you had a dentist appointment?
about like maybe a month ago.
Okay.
Yeah.
Were you assessed for periodontal disease?
Years ago maybe, but not this time.
Okay. I can write a referral to you. If the problems persist, you can use it.
Okay.
If not, you don't have to. Okay. All right. I want you to pick a point up there on the wall. All right. Let me know when my light enters your field of vision. Say now.
Now.
Okay.
Now.
Okay.
Now.
Good.
Now.
Good. Let me know when the light leaves your field of vision.
Now.
Okay.
Now. Now.
Okay.
Now.
Good. All right. All right. Now let me know which light is closer to you. The light on your left or your right?
Right.
Which light is closer, left or right?
Left.
Okay, good. I want you to keep your eye on the light with the pink stem and ignore the one with the yellow. Okay? Okay, now switch and look at the one with the yellow stem. Okay, very good. No issues there. Your vision seems to be very much intact. Okay. Just going to do a couple facial measurements, okay? Just making sure that there's symmetry here. No drooping. 10.7 centimeters on the right side. Okay. Going to do the other side just to make sure. Exactly 10.7. both sides from the hairline to the top of the brow. We're at 0 hair on the line. 6 3/4 centimeter on the right. Okay, and 7 on the left, still in the normal range. 6 3/4 right. 7 on left side. Okay. I'm just going to measure the lymph node area. Excuse my reach. Zero here to the side. That's 10.3. And 10. It's 13 centimeters on the left. Going to the other side. Okay. 14 on the right. That's good. I don't notice any protruding lymph nodes or asymmetry. Alright. I'm going to just measure right here. Okay. I'm just going to measure right here across the chest. Okay. Okay. Go ahead and move your head to your side. I'm just going to go ahead and look inside your ears. Okay. Alright, your tympanic membrane is pearl gray. I don't see any, I see no wax here, and you can be very good. A little bit of wax here on the side. Okay, I'm just going to look out here on the outer auricle. Okay, I'm seeing the beginning of just some bacteria buildup, but I like to clean here on the outside of the ear. That's okay. Okay, I'm just going to check here. Okay. How are the piercings? I don't see any signs of infection, so I see a little bit of scaliness in the back side. Nothing that some moisture can't fix. Go ahead and turn your head towards me. Good. Okay. Don't want to hurt the piercing, but I don't see any issues in the ear. Nice buildup of soft downy hair. I'm liking the color that I see, and no signs of infection, no redness. I just think it's a good idea just to clean this outer area. Okay. So yeah, go ahead and turn your head towards me. Perfect. Okay. Just going to dot the surface of your Next, just going to be adding a little bit of water treatment right here to the outside, antibacterial, infused with moisturizing aloe. And just going to dot that here with a cotton pad. And lastly, I'm just going to add a little bit of just some foaming treatment. Okay. Just to sanitize the piercings. Just gonna feel a little bit like a crackling sensation. Going to get right behind the ear as well. Okay, going to just do a very light pressure point test here. Let me know if you feel 1 or 2 pressure points along the edges of the ear, okay?
1,
Good.
2, 1, 2, 1, 1,
Good.
2, 2,
Good.
1, 1, 1,
Good.
2.
Excellent. Okay, go ahead and turn your head the other way. Perfect. Okay, we're just going to do something very similar here. I'm going to start just by lining the side of the ear. With some inflammation treatment. Okay. Okay, and I'm just going to use the wrinkle sponge too. Really good. Now the soothing water and aloe vera infusion. I'm just going to dot it like the ear. Perfect. Okay. And followed by foaming cleanser. Just gonna apply directly to the edge of the lobe, okay? How are you feeling? Good. Okay, good. and turn your head all the way back to center. Perfect. All right. So now that we're done with that test, I'm just going to do a few hearing tests for you. Okay? So close your eyes. I'm going to be whispering some things in your ear. Repeat exactly what you hear after me. Rhubarb. Rhubarb. Good. Turn your head this way. Good. Great. Labradoodle. Labradoodle. Golden leaves. Golden leaves. Tissue. Tissue. Machu Picchu. Machu Picchu. Ireland. Ireland. Television. Television. Broadcast. Broadcast. Wood. Wood. Metal. Metal. Flower. Flower. Chandelier. Chandelier. Good. I'm going to be making some rustling sounds with my gloves. Let me know if you hear it on the left or right side. Okay. Left. Right. Right. Left. Both. Good. Okay. And using my tuning fork, let me know if which sound sounds closer to you, A or B. This is A. This is B. Okay. Okay. Let me know which sound is closer. Okay. A. B. A. Good. A or B. A. Good. A or B. B. Okay. Let me know if the sound sounds like it's coming from above your head, below your head, to the left or to the right side of your head, okay? Above. Okay. Above. Okay. Right. Right. Above. Okay. Left. Okay. A couple of those were a little inconsistent. Okay, just going to grade that down. Okay. All right. Next, you're going to feel a vibration. I'm going to be placing it on your forehead, the bridge of your nose, your chin, both sides of your shoulders. Let me know when the sound stops. Okay? Just say now. Yeah, let me get a better little one here. Okay. Now. 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 Okay, very good. Okay, my top. Next, we're going to move on, and I'm going to take a quick look at your scalp. Okay. Do you have any issues with your scalp or hair?
Sometimes itchiness if I switch my hair products.
Okay.
Yeah.
Great. We'll take a look.
Thank you.
All right, go ahead and lift your head for me. Good. Your hair is beautiful.
Thank you.
I'm not noticing much damage at all. Have you ever had it dyed?
Yeah.
Oh wow. I can't tell. Okay. Just gonna go through the nice comb and see. I'm just making a part here so I can just take a look at the hairline. I'm not seeing any redness, barely any flakes. Okay. Just going to take a look with my pen light, making sure that I'm not missing any purpling, infection, or flaking. Okay. I'm going to be tapping right here on the part of the scalp. Let me know how many taps you feel.
3.
Okay.
1. 2.
Okay.
3.
Okay. Very good. This time with a different texture. Let me know how many scrapes.
2. 2. 3. 3. 1.
Good.
2.
Good.
1.
Okay. Just a different solution here. Almost out of it, but it's just going to help moisturize the scalp. Just going to feel a little cool. Okay, I'll be just smoothing it in here. Okay, I'm going to just brush it through here. Taking a look here in the skin, right above the ear. gonna do is here. I'm just gonna be a little perfectionist about this. Okay. Alright, we're gonna do a sharp or dull test right around the part and around the ear. One second here. I think I can get this a little better. Okay, so next is going to be a sharp or dull test here. So this is going to be a sharp sensation, and then this is going to be dull. It's going to feel cold and more smooth to the touch, okay? Okay. Sharp. Good. Sharp. Dull. Good. Dull. 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 Sharp. 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 Good. Sharp. Okay, no. So this is dull and this is sharp. Let's try again. Dull. Good. Sharp. 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 Dull. Good. Dull. Sharp. Sharp. Good. Dull. Sharp. Dull. Dull. Sharp. Sharp. Perfect. Excellent. Okay. And so just in the same area, we're going to do wet or dry, okay? So this is wet, and this will be dry. Okay. Dry. Good. Wet. Good. Dry. Dry. Wet. 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 Good. Dry. Good. Dry. Wet. 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 Dry. Wet. Dry. Dry. Wet. Okay. Go ahead and bring your head perfectly back to center. That's great. Your hair has grown a lot longer since I last saw you. Is this the plan?
Yeah.
I'm loving it. Thank you. Looks really healthy. It's just good to be sure and assess during the winter months. I'm seeing really strong roots. Just gonna add a little bit more. Keratin oil just to the top. And just notice a tiny little indentation, so I'm just going to go ahead and just check that here. Just going to check some very small freckling here, about 1.5 centimeters in. It is less to the touch, flush with the skin, I mean. And I'll say the surface area is about 0.5 centimeter by 1/2. Just gonna write that down, okay? Just 1/2 by 1.5 centimeters. Okay. Just going to travel down the scalp, dotting the area. I'm seeing a very little mole here. It's about a couple millimeters, I'd say. I'm just going to measure 2 millimeters. Let me go ahead and get in there. It's about 2 millimeters in length, and it's symmetric. Not raised and very light brown in color. So okay. And just traveling down to the base of the scalp. Yeah, that is. I see a little cherry angel right here. Very cute, bright red. Just going to take a little measurement, stay exactly still. This all looks very healthy to me. Let me just go ahead and get in there. Alright, that is 0.5 centimeter by only 1 millimeter, so it's a little oblong in shape, but I've seen thousands like that before, so not to worry. Cherry and gioma. Okay. Right. Does the sensation feel cold to you or warm? Cold. Okay. Cold or warm? Warm. Okay. Cold or warm? Warm. Cold or warm? Cold. Okay, good. Cold or warm? Cold. Good. Cold or warm? Cold. Good. Alright, I'm very pleased with the scalp portion of your test. So if it's okay with you, I think we're going to move on to the abdomen, okay? Okay. Alright. Okay. Any stomach issues, gas or bloating?
Maybe bloating.
Indigestion? Okay.
Yeah, especially depends on my diet, but
Sure. Does this happen anytime near your cycle?
yes.
Okay.
Yeah.
That's quite common. It's annoying though. Alright. Do you mind if I lift your shirt so I can visualize
Go for
the
it.
abdomen? Thank you. Okay. And can I unbutton
Yeah,
just the
sure.
first part? Yeah, okay. Okay. Sorry, it's gonna feel a little bit cold here. thumbs are normal. I'm gonna go ahead and just palpate. Sorry, my hands are a little cold. Let me know if you feel any sudden pain.
Yeah, maybe there.
Right here? Okay. And what kind of pain is it? What is it? Is it a soreness or?
It's kind of like sharp.
A sharp pain?
Yeah.
Okay. Okay. Do you notice these pains after you eat any certain foods? Like I think you mentioned, but spicy, fatty foods?
Mostly like fried food.
Okay.
You know? Causes that.
Go ahead and take a deep breath in and out. Okay. Okay, one more time. Okay. Just going to do some percussions here. Okay. Well, your organs feel normal in size. We're just going to do one quick test. I'm going to be placing this against your hip bones and also the center. Again, let me know when the vibration stops, okay? Okay. Okay, good. Good.
No.
Okay, great. Great. I am going to actually look at your feet right now, and then we'll flip you over and take a look at your back, okay? Okay. So I'm just going to be palpating the feet, okay? Feeling for any... You do have a little bit of coldness in the extremities. Is this it's kind of a seasonal thing? Okay. Any pain here?
Yeah, I think over there it's kind of
On the
because
outside?
Of the shoes I wear.
Okay. What kind of shoes?
Lots of heels.
Okay, okay. It's good to take breaks. I know there are some heels that you can purchase that are orthopedic, so you can have style without sacrificing comfort and the health of your muscularity. Okay, here pain?
Less on that foot.
Okay. All right, I'm just gonna grab something here. Just going to be taking a look at the sides of the feet. I don't see any loss of circulation or discoloration. It's just a little cold. Just look in between the toes here. Okay, just checking for fungus. I don't see anything. You're feeling very well cared for. Okay. I'm going to palpate the ankles there, right? Perfect. Okay. I'm gonna palpate this ankle to here. Any pain here when I squeeze? Just a little bit. Is it a sharp pain?
It's sharp. Could be because of the fall that I had.
Okay.
Rollerblading.
Have you been feeling it when you walk?
Yeah.
Okay.
But not all the time.
I'm gonna say you need to give it a week off. I'm gonna write you a note, and you can show it to your employer without any problem. You know, just to give you a week off. Okay, I'm just gonna check your Rapinski response here. Perfect. Very responsive. Very good. Go ahead and close your eyes. Okay, I'm going to be touching the pads or the heels of your feet. Go ahead and tell me which one.
Pad.
Good.
Heel.
Good.
Heel. Pad.
Great. I'm going to be squeezing the toes and let me know if you feel it on your right foot or your left foot, okay?
Left.
Okay, is that the pinky or the big toe?
Pinky.
Good.
Right. Big toe. Right. Pinky.
Okay.
Right. Middle.
Middle toe, good.
Left. Middle. Left. Middle.
Okay. It's about 27 here. And here. So I don't see any swelling. I'm just going to measure the ankles now. About 10.7. Okay. And 10.6 and a half. I'd say that's close enough. Okay. This is shark. This is cold. Let me know if you feel a shark or a cold.
Cold. Shark. Shark. Cold. Cold. Shark. Cold. 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 Shark. Cold. Shark. 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 Cold. Shark.
Okay, great. I'm going to have you flip on your back and we're going to just briefly examine that, okay?
Okay.
All right. Okay, so I'm just going to be listening first. Good, deep breath in. And relax, good. Okay, you can just relax now. Okay. Just gonna palpate the spine. Just going to be feeling. Okay. Let me pain starts. Okay, I'm just gonna bring my hand down. She said it was more toward the center.
Yeah.
Okay.
Right there.
Right there is when it gets kind of elevated. That would be about right at the base of the cervical spine. Okay. And let me know when and I'm sorry that's hurting right now, but let me know when it stops.
That's the worst part.
Right here?
Yeah.
Okay, yep.
Gets better there.
Down here, so this is the main area.
Yeah.
Okay. Alright. I'm just gonna be pulling some of the skin right now just to loosen up the okay. So just gonna free up the cells beneath. It shouldn't be hurting too much. It should just feel like a release of pressure. Okay. I do feel a lot of tension here in the center, so definitely it seems like it is from a fall. Definitely. Okay. Very lightly going to be tapping here. Just going to measure here to see if the spine is symmetric on both sides. Just going to measure here outward. 6 inches. This is the same. So at least you're symmetric. I'm not seeing one side. I'm not seeing a spine bend. Okay. Just gonna feel down here. Okay. Dear. Going to the top of the bottom of C5. That is symmetrical then. So. Okay. So I'll balance this section here. Okay. I'm going to be applying a foaming lotion. There's just to moisturize the area. And I'm going to be using a activator tool just to reset some of the tension. Sometimes the spinal discs tend to collapse on themselves after an injury like this. We just want to make sure that doesn't happen, okay? All right. Sorry, this is a little noisy. Alright. Alright, I'm just going to be, you're just going to be feeling a light pressure on both sides of the spine. take a deep breath in here. Good, and relax. Excellent. Just alternating with some skin pulling here. Okay, my top. So hopefully that helped you feel a little bit better. I'm going to give you a follow-up call in a week. And if your symptoms haven't improved, we're going to go from there. I didn't notice anything that is too alarming. I think this will heal in time, but I think you need to just take a break from walking for a while and those shoes, okay? And definitely from roller skating, as fun as it is. Okay? So I'll leave you to get dressed. Thank you so much for coming in. You're very, very healthy, okay? And I'll see you here again next time. All right?